Welcome to JAMA AI Conversations. I'm Roy Perlis, Editor-in-Chief of JAMA AI.
And I'm Yulin Hswen, Associate Editor of JAMA and JAMA AI.
Today we're discussing a topic that sits at the intersection of medicine, AI, ethics, and society. Earlier this year, Pope Leo XIV released his first encyclical, Magnifica Humanitas. I'm sorry for butchering that Latin, focused on AI and the future of humanity. And just yesterday, Dario Amodei from Anthropic posted on this topic as well, noting that in many areas we actually need more regulation to be sure that we get what we need and want out of AI, but also that in some areas, including those related to new treatments in particular and to health, we probably need more efficient and rapid regulation. So, unfortunately, neither the Pope nor Dario were available for today's show. However, today Yulin and I will try to talk through how some recent work across the JAMA network evaluates how generative AI is being used in healthcare, including its broader impacts on the workforce and on mental health.
And what's interesting is that many of the concerns raised by the Vatican, which are about human dignity, dependency, equity, concentration of technological power, and preserving human judgment, are the same type of questions that are emerging from empirical research in AI and medicine.
So, we are taking on some weighty topics today on the podcast. And in particular, we'll be talking about some recent studies in the JAMA network and what they might tell us about the promise and the risks of AI and kind of how that relates to the encyclical and thoughts about regulation. So, let's start with one of the problems, which is that mental health systems globally are struggling to meet the demand. And that's certainly the case in the US.
Yeah, I think that actually is probably globally, Roy, too. This lack of access to timely mental health care, counseling, or even behavioral health services. And whether we like it or not, AI is filling that gap. And so the question is whether people are using AI for mental health support. And I think the answer really is that they already are.
I think there's no question. And just to put this in context, one of the points that the encyclical makes is that AI is not inherently good or bad, right? We have a tendency to put things in one bin or the other. What what the Pope argues is that technology really reflects the values and the incentives of the people who build it. So when it comes to mental health, we really need to think in terms of what are we trying to accomplish here?
That's why, one of the first studies that we talk about comes from Mathieu and colleagues, which was published in JAMA Network Open in 2026, looking at generative AI adoption among children and adolescents. What they did is they analyzed device activity from more than 6,400 children and adolescents and found that approximately one third were using generative AI applications. And among teenagers, that increased to about 50% among those aged 15 to 17 years old.
I can't emphasize that enough. The issue here is whatever kinds of normative claims we want to make, descriptively, people are using these tools for mental health or for addressing mental health needs. I think one of the things in the paper that concerned me the most was that among the most frequently used applications were these sort of AI companions, which are unregulated, really all over the map in terms of what they actually are, what they do.
And this really directly echoes a concern raised in the encyclical that warns societies are delegating their thinking, their decision making, and relationships to machines. This study really shows that possibility may be emerging already in young people.
Yeah, I think the question is, again, getting back to things not being inherently good or bad, can we get around the fact that lots of young people report that these tools are in fact helping them?
So that leads into the second study, the use of generative AI for mental health among US youth, published in JAMA Network Open. And they looked at a nationally representative survey and they reported that among 13% of youth, that reported generative AI for mental health advice, 90% of those reported that the advice was helpful. So we are really seeing the fact that not only are youth using it, but they believe at least it to be helpful. Now, whether or not that is actually improving health outcomes, and mental health is another thing. But I think it's this idea that as a user, you are believing that these machines are helping you.
I think that's a pretty remarkable finding because it does point out this tension where people tell us that they're finding value in these tools, but we don't know a whole lot about objectively whether the tools are helpful to them and in particular about the long-term effects. And I would just note in passing, even though we're not talking about it quite yet, it's not dissimilar to scribes where you ask people and they say, "Oh yeah, this is helpful." But when you look at their actual impact, we don't necessarily know how helpful ambient scribes are long term.
Yeah, so I think we're going to touch upon that in a bit in another study. I do want to note for this study that the importance of really looking at equity, and what was found is that Black youth reported significantly lower perceived helpfulness. And so I think we really have to ensure that these AI tools are really benefiting all populations, and that we have to really start looking across different demographic groups, and also really ensuring that they are culturally responsive as well. We do not know the future of that in terms of across various populations.
Yulin, I will take any excuse to talk about scribes, but you're right to kind of point us back at the fact that beyond not being inherently good or bad, these things are probably good for some people and less good for others. And understanding how we parse that out and who benefits and who doesn't and who might be at greater risk is something we know almost nothing about at this point. So, studies like this that do start to try to understand who's using these tools, who finds them helpful, I think are really kind of critical in that regard. So, another study that I think is relevant here is one that looked at whether AI actually improved mental health outcomes.
Yes. So this was a good study by Shoshani and colleagues where they actually did a randomized clinical trial involving nearly 1,000 university students, and it was published in JAMA Network Open. And they looked at participants receiving an AI intervention, and they compared it to those that were on a wait list as well as those that were participating in a group therapy. And those that actually were in the AI intervention experienced greater improvements in anxiety and well-being compared to those in group therapy.
To me, one of the most interesting findings in this study was what they saw as far as therapeutic alliance.
Yes, it's an interesting point, but it also, again, starts to talk about this idea around either a placebo, or whether you have this belief in a connection, or the belief in empathy coming from a machine. But participants develop this sense of warmth, trust, and connection with the AI system. And so that predicted the engagement, which in turn predicted clinical improvement. In other words, the more of an attachment that you had to the AI, or a belief, in the AI, the better mental health outcomes that you had. This idea of how much you entrust your mental health in the AI system then reciprocates that.
I think it's interesting. I think it also makes me anxious because if we really can form these meaningful therapeutic relationships with machines, which the jury is out, but certainly some studies like this do report this sense of alliance with the AI tool. That gives developers of these tools a lot of responsibility if people are actually going to be forming connections with them that I don't think we think enough about. And to tie this again back to the encyclical, it does talk about, machines are different from humans and machines can emulate empathy, but it's probably not the same thing, which actually brings me to the next paper we want to talk about. So, Vatican talks a lot about preserving human judgment, the importance of maintaining the human ability to make decisions. And I think this next study illustrates why that may matter a lot in what we do.
Well, I'll probably get you to talk about it a little bit since it was your study and it brings back the scribes. And it was published in JAMA Psychiatry, looking at AI scribes and psychiatric documentation in primary care, where you examined more than 20,000 clinical encounters. And again, what was interesting about it was that the AI generated notes documented substantially more psychiatric symptoms than conventional documentation. But patients whose visits used AI scribes were significantly less likely to receive psychiatric intervention. So it doesn't necessarily translate right into better care.
We don't know whether using scribes is going to lead to better care in the short or the long term. First of all, I'm delighted to have another chance to talk about scribes, but this study really came about because my own health system was rolling out scribes kind of unevenly across our system, and it gave us a chance to look at whether there were differences in the visits that used scribes or used human scribes or used no scribes at all. And it really was pretty clear when we looked in primary care at specifically depression related interventions that while there was more documentation, it didn't necessarily translate into more care. Now, we don't know that more care is better care. I think that's an important caveat, but it at least raises the question of like, how are scribes going to change how we take care of patients?
I really wish there were more studies like this. I'm not just saying that because it was your study, but I do like this idea of actually separating the kind of differences between, like, okay, it can document more notes. And I've heard you talk about how, yes, is 10 pages better than 3 pages? Is 50 pages better than, 10 pages? And so this idea about just because it's been documented doesn't necessarily mean that it's better, and it raises that concerns that we talk about, which is this cognitive complacency and whether or not clinicians assume this problem has been addressed simply because it has been documented, right? Just documentation. More isn't better in that regard. I like that we're understanding that in this study.
Well, and this is an interesting case of since scribes really are carved out from other kinds of regulation, here's an intervention that's already in the clinic, already been rolled out at scale, and we still know so little about what it does to outcomes and what it does to day to day practice, which I think speaks to that second document that I mentioned, Dario Amade's comments about regulation. We have a lot of work to do to make sure that our regulation catches up to some of what's already entering the clinic. I want to switch gears a little bit. Our last paper to talk about today addresses whether AI can think like a therapist.
I like this study. So, Tefera and colleagues did a study in JAMA Network Open that was comparing large language model responses with motivational interviewing therapists. They took video recordings from YouTube that were with professional motivational therapists, and they asked ChatGPT 4 to generate appropriate responses to the patient. So they wiped out the therapist responses and then they asked ChatGPT to be the therapist. What I like about it was that they did see that there was a lot of consistency in the type of responses that the AI was giving compared to the therapist. Maybe not the exact same type of wording, but the same overall type of responses. But over the longer term, started to really diminish. So, for instance, the AI therapists would be more general, be more verbose, but didn't have that depth or content or history that a true therapist would be doing. So, for instance, if they talked about family members, their father, their mother, the AI would just make kind of general comments where the therapist would bring that type of knowledge back into the conversation. And so we really don't know the longer term, both the effects of the AI model, but also whether or not the AI model can keep up in terms of its memory, in terms of its depth. So over time, that relationship might actually erode. So it's interesting.
You make the point that this used GPT 4.0, which feels like an eternity ago. And it does point out one of the challenges in studying these kinds of interventions is by the time you do the study, write the paper, get the paper through peer review, publish the paper, like you're a year behind or 2 years behind, and the models are moving so quickly. I think it gets back to the question of regulation. You're doing a study designed to get some sort of approval for your intervention. And by the time the study is done, the intervention's out of date because the models have moved on. So we're not going to solve that today, but it does speak to the problem of how do we regulate these things? I also would say, so just by way of background, motivational interviewing is a technique that's often used in substance use or really any sort of circumstance where you're trying to help people change their behavior. And it's a very important set of skills that not all therapists have, but can be useful in a bunch of different contexts. I think it's troubling to me how much a language model can sound like it's doing this, but it's doing it in sort of an empty way.
Hmm. And what's interesting is you said about ChatGPT 4, that was also the model that was extremely sycophantic, right? And so that could fool someone into believing that they, are hearing what they want to hear and being really empathetic and really relating when in fact there's not a lot of depth to it, right? And that like nuanced judgment that human therapists bring to these complex interactions really isn't there, but it appears that way. And hence the discussion we just had about how if you believe the AI is really caring and you have that relationship, then maybe you think it's helping, but thinking that it's helping is not the same as actually helping.
I think that's a useful distinction to make. My general sense was that the encyclical added a perspective to AI that hasn't really been part of a lot of scientific discussions. It sort of pulls together a lot of different threads that folks like us who are trying to apply AI in a health setting, we don't always zoom out to that level. So I found it helpful in that way.
I think it's a discussion we haven't had. I think we talk about public health, medicine being part of the conversation, but I think this idea of like who controls these systems, what happens when the power becomes concentrated, and this really emphasized how the power should not be concentrated in one area, especially by these companies. And so these are really important statements to make and to think about. And yet, here we are where I think that there is a lot of concentration of power. So I don't know if that's a discussion we have where how do you break up that power? How do you ensure it? And I think one of the things we've discussed is the importance of data in the clinical setting and how that really actually needs to be preserved in a way.
Yeah, if you pull all of this together, I think what we're kind of slouching towards is some idea that we probably do need as a society and specifically as people working in healthcare to think about what are our goals and how do we make sure that the regulation, the framing around these new technologies is getting us towards those goals, which is sort of what the encyclical is arguing as well. I do want to mention that for all our discussion of mental health, what we don't talk enough about is the consequences of changes, massive changes in the workforce. And so we can talk a little bit about, does using this tool or that tool affect your day to day mental health? But there's a broader issue about the importance of work and the kinds of work people do. And I think what I valued in the encyclical was that it pulls us back in that direction, right? There are lots of reasons for work. And that's something that will have a massive impact on mental health that we're just not talking a lot about in the health system at this point.
So when you're talking about the workforce, Roy, are you talking about the fears behind job loss or complete industries being replaced by AI? Or are you talking more about the loss of interaction between like human and clinicians, from that workforce standpoint?
I think both. I think as physician, I worry about the impact on my patients, and as a public health person, I think about the impact on public health when jobs go away or change in fundamental ways. But frankly, I also think about the impact on physicians and on healthcare more generally when I think we've underestimated how large the shifts are going to be as we move to more AI in healthcare. So, do I worry about what's going to happen to my job and the jobs of the people we're training? Yeah, more than we're talking about and more than we're commonly admitting. I think that's the reason to say, hang on as a society, let's just zoom out a little bit and take stock of where we are.
Well, you know my take on it, where I'm much more critical in the way that I believe AI is going to help either solve healthcare or improve it. I'm not saying it for other areas, but in specifically healthcare. I think that everybody comes in to healthcare and feels they can fix it. It's like this easy fix, and it's not. It's so complex, it's so big, and we've tried. And the other big aspect of it, I think so many of the issues are upstream and they're really societal and they're really about social determinants of health, like to really truly improve health outcomes and requires a lot of time, a lot of effort. I think it's wrong to say that it's going to be this quick fix with just technology.
Well, since we are just about out of time, I think we're not going to solve this today. I will point out I like the framing about this technology. Will it serve human dignity and the common good? That seems like reasonable thing to end the discussion today. So thank you for joining us for JAMA Plus AI Conversations.
Until next time, thanks for listening.
This episode was produced by Daniel Musisi at the JAMA Network. You can find links to the papers in this episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcast. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.